I believe that the American people have come to expect that when the Surgeon General speaks out on a topic, it will be based on the best available public health science. Not politics, not even religion or personal opinion, but the best available public health science. And that can be quite a challenge, even for the Surgeon General. There's a story that we used to tell in Washington, and from all indications it's true. It's about Dr. Luther Terry, and whom some of you remember, I'm sure. But Dr. Terry was actually the first Surgeon General to release an official Surgeon General's report, and it was that 1964 report on smoking and health. It was during a time when there was a lot of debate in this country and throughout the world about whether, in fact, smoking was harmful to your health. And there were a lot of people trying to convince us that it was not. There have been a few studies scattered around in this country and other places. And Dr. Terry pulled together an advisory panel of leading scientists, and he asked them to look critically at this issue, to look at all of the research that had been done in this country and the world, and to advise him on what he should officially say about smoking and health. And so in 1964, Dr. Terry released the first ever official Surgeon General's report, and it was on smoking and health. The story is that Dr. Terry was on his way to the press conference to release that report, and he was in the back seat of his car with his assistant, and he was smoking more than usual because he was nervous. So his assistant said, "Well, Dr. Terry, do you know the first question they're going to ask you when you release this report?" He said, "No, what's that?" He said, "They're going to ask you if you smoke." And Dr. Terry said, "Oh, no, why would they? That's a personal question. Why would they do that?" So sure enough, he went on to the press conference and just did a great job. He convinced any reasonable person that smoking was harmful to your health. And so the first question was, "Well, Dr. Terry, do you smoke?" And Dr. Terry said, no, I don't. So as they do in Washington, the reporter had done his homework. So he said, "Well, Dr. Terry, when did you quit?" And Dr. Terry said, "I quit 30 minutes ago." And he never smoked again. In fact, in the year 2000, when I released the Surgeon General's report on reducing tobacco use, Dr. Terry's son, John, was there. And he told a story about how his father walked around the rest of his life with a lapel pin saying, "Thank you for not smoking." But it is true that 9 out of 10 of the members of the advisory panel and Dr. Terry were smokers. I hope you get the moral to that story. The report was not based on their own opinions or their behavior or their politics. It was based on the public health science. And that's what the American people have come to expect from the Office of the Surgeon General, that when you say something, it will be credible and it will be based on the best available public health science. And that can be quite a challenge because the Surgeon General operates in a very political environment. It is on a day-to-day basis. In fact, whether or not you get a budget is determined politically. So when I became Surgeon General in 1998, of course, you remember that Dr. Elders, Joycelyn Elders, had been fired by President Clinton in December, I believe, of '93. And so the office had really been vacant for 4 or 5 years, and Congress had really sort of gutted the budget of the Surgeon General's office. I never really had much of a budget because of that, but I was able to influence how other people spent their money, like NIH and CDC, and so we were able to do actually more reports than any Surgeon General in a single term. So it's a very political environment in which the Surgeon General has to try to be responsible to the American people. I will mention that there is one other major responsibility of the Surgeon General, which some of you are probably aware of, and that is the Surgeon General commands the Commission Corps of the Public Health Service. And the Commission Corps has about 6,000 members, physicians, nurses, dentists, public health persons, veterinarians. And basically, the members of the Commission Corps are on call 24 hours a day, 7 days a week, to respond whenever there's a threat to the health of the American people. That means that if there's a flood, like a few years ago in North Carolina, or if there's an infectious disease outbreak, whether it's West Nile fever or something else, or the World Trade Center being attacked and a lot of people's lives being hanging in the balance, the Commission Corps is deployed. So on September 11th, 2001, I was on the way to the train station to catch a train to Princeton when I heard about the attack on the World Trade Center. And I had to get out of my car right then and there and activate the readiness force of the Commission Corps. And several people from the Commission Corps went to New York, and some of them spent a lot of months there, even in being involved in identifying body parts. So that's the other major responsibility of the Surgeon General, is to oversee this Commission Corps. But the main thing that the American people have come to know the Surgeon General for is the responsibility of communicating directly to the American people